Building off of the previous points, I think that particularly transition to adult care is something that I find myself very passionate about, and it was something that was very poorly handled in my own medical care, to the point where there were some life-threatening experiences just because of an inability to communicate with the pediatric healthcare system. And perhaps biased because I've done some research in this area, but the use of digital healthcare as a tool to be able to better this pediatric to adult healthcare system is something that I'm quite interested in. And I think that that can ultimately be one of the biggest solutions, is really putting those supports in digitally for people and making sure that they're able to interact with the pediatric healthcare system in a proper way.
I'm a new member to the NYAP. However, I would just like to say I agree with a lot of the comments here on increasing research around transition into adulthood for youth with disabilities. A lot of those services do seem to change as you enter adulthood, and having more information on how to enter the workforce or university would be really excellent. A lot of information around disclosure, how that impacts different employers' view of you and your transition through that process would be really interesting to have. Another area I think would be interesting to have more information on is how accessible information and services are. I think a lot of people don't have the information necessary to even know where to look or where to start to gain accommodations. And so just looking at who is accessing services and who is not, and why, what's holding them back from getting the services and supports they need.